Hello, I'm Jessica Lovell, and happy holidays from the Morning Medical Update team. We are taking some time off to spend with friends and family over the winter holidays, and we sure hope that you are doing the same. Until we return with our live programming on February 2nd, please enjoy this Encore presentation of one of our very favorite episodes.
I don't think my outcomes would have been the same.
Coming up today, a young mom diagnosed with breast cancer makes a life-changing decision. Her health is worth the drive. We'll show you how we coordinate care and tailor treatments. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. It started with a routine checkup, and then Ashley heard the words no one wants to hear. You have cancer. Ashley lives in rural Kansas and was faced with a daunting choice. Where would she go for her care? She chose the University of Kansas Cancer Center, and this morning she is sharing her journey, which includes road trips, tailored treatments, and even a few TikToks.
Higher?
These are the moments Ashley Hurd worried she'd miss.
Oh my goodness, Betty.
A hot day on the playground with her 4 kids and her best friend and her daughter.
Go, Scar, go!
We caught up with all of them after Ashley's doctor's appointment.
She has cancer. Bummer. But she doesn't have cancer anymore.
Ashley has 11-year-old twin daughters. There's also 4-year-old Coco.
It's like cancer.
Coco can be blunt.
She would whisper to people when I would have my wig on and we'd be in church or something. She'd be like, my mom really doesn't have any hair.
So, 4 charming kids and a loving husband. It looked picture perfect until that routine mammogram revealed breast cancer.
Definitely a tough pill to swallow.
Ashley considered her options. She eventually chose the University of Kansas Cancer Center for her care, even though it's more than 5 hours away.
It is a long drive, but my health is worth it.
It's been a long road. Ashley's TikTok videos tell the story. A young mom wanting help for anxiety and depression, discovering cancer.
I was recently diagnosed with breast cancer, and I start chemo next week.
Going through chemo and surgery. She documents the tough moments. But keep scrolling, Ashley is a fighter. She's working out, and then this. Ashley credits the medicine and the encouragement she got from family and her doctors.
This is what you need. This is our plan. This is what we're going to do.
And not just a firm medical plan, a plan that recognizes the travel burden for Ashley.
It is us as the provider being mindful on when patients are coming and going and maximizing their time here.
Dr. Jamie Wagner is Division Chief of Breast Surgical Oncology at the University of Kansas Cancer Center. As part of Ashley's care team, Dr. Wagner was also mindful that Ashley needed chemotherapy before surgery.
The tailored therapies, though, goes to another level where we currently practice of not just getting the right medicine, it's even getting the right order of treatment.
I don't think my outcomes would have been the same.
Slow motion.
Mentally, I'm getting there. Cancer's hard, and your life changes.
A reality for now, and down the long and windy road, back home to Garden City.
We're so glad to have Ashley joining us virtually from Garden City this morning. Ashley, how are you?
I'm good.
Good to have you. Thank you so much for being here and sharing your story. Here with us in studio is breast surgical oncologist Dr. Jamie Wagner. She is the Division Chief of Breast Surgical Oncology. And also joining us is Dr. Eric Lai. He's a board-certified plastic and reconstructive surgeon. Good to have you.
Great to have you.
Great to have you. Good to see you. Well, this is your first time with us, so we're just glad to have you on the show with us and joining the conversation and sharing more about Ashley's journey. Ashley, you work in a school as a speech therapist. Tell us about your job and dealing with cancer at the same time. That can never be easy.
Yes, I work in a school district. I work with special education students on their language and articulation. And yeah, it took a toll on me last year. They didn't get the same energetic Miss Ashley that they're used to. but we got through it.
I bet. Okay, so then how do you balance that with being a full-time mom? We saw a little bit in the video, but it's hard to be a full-time mom and work anyway. But then you add cancer to the story. What was that like for you?
Oh, it was tricky navigating everybody's schedules and making sure that we're all getting where we need to go and that I can still have my same work performance. I'm thankful that I have a good support system around me that is understanding.
What kind of conversations were you having with your children at the time?
My own kids, I was very upfront with them on how I was doing, and there are going to be days where I am tired and I need the help from them, and they really stepped up and were able to help out around the house and be there for me too.
I bet. Helping out mom, I'm sure they love doing that. So I have to ask you, Ashley, what care options were there where you live in Garden City? Did you consider utilizing those?
I did. So we don't have the surgical staff here in Garden City. So I initially was in Wichita for my care. And really, I was just having to coordinate a lot of it by myself. It felt more disconnected. So I was happy to come to KU when everything was all planned out for me and everybody talked to each other. It made my life a lot easier.
Dr. Wagner, how do we coordinate care for patients who live nearly 6 hours away and sometimes further?
Yeah, we actually have a lot of opportunities on how we've now set up our breast program as an entire programmatic treatment team. First and foremost, I think one thing that really was a benefit that I'm excited that we've developed over the last 7 years is our multidisciplinary clinics, and we've expanded those so patients like Ashley that are driving such a distance can see all of their providers from getting their imaging reviewed, any additional imaging that might be needed for us to help make that plan for the treatment, and then they see the breast surgical oncologist, medical oncologist, and the radiation oncologist in sequence all in one day. Although we recognize it can be a long emotional day, but it will cut down so much, and it also allows us to real time make modifications as we are getting additional information from either the imaging or even from the patient during that visit.
What kind of challenges and barriers are there for people facing a cancer diagnosis, but also living far away who need, the top of the line cancer treatment?
Right. The one thing that we do not want is that barrier of travel, the distance, to inhibit patients from getting the very best care that they can give. Because we understand that when patients are treated in NCI designated cancer center, 40% of the time for breast cancer patients, they'll have a change in their diagnosis and ultimately their outcome. And so we have definite opportunities. Our social workers are amazing at the cancer center, from just reaching out, seeing what the patient's needs are. Is it emotional support? Very importantly, the financial toxicity. We think about not just the gas that it takes to get here and the transportation, but also it is more time off work than somebody that lives in the metropolitan area that can still work a half a day and come see us, right? Right. It's at least a day, sometimes 2 days, depending on that distance. So how can we help with gas cards? Even lodging, when patients might need to be here for 1-2 days for treatment, sometimes even longer.
And just alleviating that burden so that they can then get down to taking care of themselves, which makes them a better patient for you to care for.
That's right.
So, Dr. Lai, you see patients when it's time to rebuild, and for women, this is a physical, this is a mental aspect of their journey. Explain the process for reconstruction. Kind of when does that start, and those conversations with Dr. Wagner and the patient?
Yeah, like you were saying, breast reconstruction is really about, restoration of both the physical and the emotional. Mm-hmm. And so we meet with patients early to plan around their cancer treatment. Options can involve like using implants or their own tissue, but the goal is to make them feel like whole again and not just simply healed. And so we want to restore both their form as well as their confidence.
And what are those emotions? I would imagine it's such an emotional time. You're having to talk about something that's going to be happening after some of these major treatment options come along, the reconstruction part, but you're having to have that conversation up front. So what are those conversations like when those emotions are running high with a patient and you're trying to make some big decisions for down the line?
I think a lot of it involves really listening to the patient. What are their goals? What are their desires? What are their ultimate aims for their reconstruction at the end of the day? And then, together in terms of like talking, and coordinating with breast surgical oncology as well as medical oncology, coming together with a plan that, that meets their goals as well as what is, possible and reasonable.
Ashley, how are you feeling following your surgery?
I'm feeling really good. Dr. Lai took good care of me.
How important has your family support and friend support been throughout this process? And just talk about that for those who might be going through this and finding that community support during all of this.
Yes, they have been so supportive. I'm very fortunate that I have family in the Kansas City area, so I've been staying with them for the duration of my treatment. So just like they were talking about, I would come up the night before and have chemo all day and then drive home the day of with my husband. So that support's been huge, as well as my parents and my friends back at home that have been taking care of our kids while we've been gone so I can get my care.
How has your mental health been? Again, it's never easy to talk about, and you've been open about that, which we appreciate, but where can people begin and where do they kind of prioritize that as they're going through this?
My mental health has been so important, and I am lucky that my primary care has referred to a wonderful therapy system, and therapy has been essential in my time in recovery as well as during treatment, of giving me strategies on how to handle all these emotions, because it's a lot to handle. Same for my family. My kiddos are also receiving some talk therapy too, so it's been helpful for all of us.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Ashley, you have been open about your journey. You posted TikTok videos. Explain why this was so important for you to do.
So that started kind of as just my own video diary type thing. I've shared posts on my other social media pages for my family and friends just to keep updated, but this is more of just an inside look of what was going on in my head during this whole process. And it helped with sidestepping some questions with people in the public, because they could watch them and see what I was really going through, and I didn't have to always talk about it all the time.
I bet you get a lot of questions. What was the response though from the public? What were some of the questions you were getting?
I think a big part of it is I have a big support system of other cancer survivors, and how they have told me that I felt this way too, and I wish this would have been there for me back when I was going through treatment. So it's really connected me with other survivors, as well as just given a deeper look into what I'm going through with people that may not really know what it's like.
It was an emotional video when you showed you shaving your head, but then it seems like you were somewhat embracing your hair loss journey. Tell us a little bit about that, because so many people have to face that part of this, and it's never fun when we hear it. But what advice do you have for people?
Just take it day by day and try not to focus on the mirror too much. I still struggle with that. I would give anything for those blonde locks back. But it takes time, and it is what it is. Just part of the process.
Dr. Wagner, I want to talk about the personalized medicine and the treatments for each patient. Could you explain the importance of specialized treatments and the team approach, and how that really, helps the outcome for the patient?
Absolutely. This, I would say, is one of the most incredible advancements that we have made for breast cancer in the last decade. Is, as I describe it to patients, I'm sure Ash will remember this, is we understand that actually breast cancer is like a family with a lot of personality types. Mm-hmm. And so the first critical aspect is identifying what is that personality type that the patient has been diagnosed with. From there, we actually have tailored therapies. But the tailored therapies has gone even beyond that, such that even getting things in the right order between local therapy and the systemic therapy, so the medicine side, what's going through your system, that has to be paired together even in the right order. And based on how we put all of that together, we can now see a difference in outcomes for patients.
Dr. Lai, how do you and Dr. Wagner work together? Because again, I think there's some thought that when, kind of old school ways where, you have this team of doctors, it's like an assembly line for a patient. They see Dr. Wagner, then she goes away, and then here comes Dr. Lai, he comes in and does the reconstruction. But actually, you guys are talking about this up front and how this is all going to go down when you finally get to Dr. Lai. So how do those conversations
we talk early
happen?
And we talk often. In many cases, we can start our reconstruction at the time of mastectomy, and oftentimes that means putting in a tissue expander, which is like a temporary device that we gradually fill to shape the breast. Sometimes we can go even directly to implant in one stage, or we can even use a patient's own tissue. But even if chemotherapy or radiation is needed, it's not necessarily a deal stopper, but we can still start safely. And as always, the key is the coordination with oncology and surgery, just to find the right plan for each patient. We can do almost always something, even if treatment is ongoing.
How has reconstruction advanced over the years? Just being able to present different options to patients. It's not just, again, one size fits all, one option, pick A or B. It's we have different routes we can take.
Yeah, certainly. I mean, there was a time where there was a lot of it was just really implant based. And now we've evolved to using the patient's own tissue, which initially started off as involving using and moving a lot of the patient's muscle as well as their soft tissue. And now we've evolved the procedure to a process where we spare the muscle as much as possible. And now we're using we're just moving their own vascularized skin and soft tissue. And even in some cases, we can at least attempt to reconstruct even some of their sensation as well by doing nerve grafting.
Dr. Wagner, Ashley told us that she questions if she would have had the same outcome if she had gone elsewhere, because there were times that she wanted to quit, and you, shocker, encouraged her to really keep going. Yeah. Is this just kind of part of the care that's provided by you and your teams, especially the emotional aspect of it?
Yeah. I guess for me, yes, and I would equally say the entire team that I am very privileged to work with has that same mentality. But, taking care of cancer patients, it's not easy, and there's a lot of emotion even on our side that goes into that. I just know that I'm serving a higher purpose, and that's why I show up every day. And that is also understanding psychosocially, emotionally, where our patients are, and helping them through that part of the journey. At least it is for me. That's why the very first visit, it's not just explaining what their treatment options can be surgically, also as a multidisciplinary team. Mm-hmm. It's for me to really understand the patient. And I want to help them along this journey and meet them where they are, but help them get to that finish line.
Yeah, Dr. Lai, it's a job for you, of course, but you're also dealing with somebody in a really tough time for them. So how do you handle that personal approach with somebody?
I recognize that reconstruction is not just simply a one-day event. It's an ongoing partnership, and so we follow patients long term, for their healing, for their comfort, for their results. We have adjustments, scar care, refinements that we do over time, and the relationship doesn't end just because the surgery is over. I mean, we stay with our patients for the long road ahead.
Could you do reconstruction and mastectomy at the same time? I think that's what people often wonder. Are those two separate surgeries?
They don't necessarily have to be. I would say in specific circumstances, we can go straight to an implant, and sometimes we can even complete your reconstruction in one go. But even if we have other issues going on, we have an advanced stage breast cancer, we need chemotherapy, we need radiation. Like we said, we can start with an expander and get the process beginning at the time of your mastectomy. Well,
let's get to some questions from our viewers this morning. All right, Jeremy wants to know for Ashley. Ashley, this question's for you. I imagine there's no way to truly know what it feels like to get diagnosed like that unless you're experiencing it firsthand. What was the most helpful thing you heard or that someone else did that was actually helpful for you?
Family and friends-wise, instead of just asking me if I needed anything, just jumping in and volunteering to pick up my kids or bring a meal by. That aspect was super helpful. And not just saying, I don't know what you're going through, but to just be there for me, because it's different for everyone.
Lynn wants to know, can aerobic exercise help prevent the recurrence of breast cancer or strengthen our immune system so that it can recognize breast cancer cells and protect us from being affected by the disease?
I don't know that I would necessarily aerobic specific exercise, but in general, the one thing that we want all patients is to maintain a good body weight, because we know that obesity is associated with higher risk of cancer and recurrence. I would say actually the greatest newest literature, it's really the combination of muscle strengthening, which we had a phenomenal video, I think, of Ashley doing that, with that cardiovascular activity and pairing that weekly. Because the other aspect is, especially when it affects men, but the dominant population with breast cancer are women. And we know that weight-bearing exercises also help strengthen our bones, which can sometimes be impacted by the treatments that are given.
This question is from Becca. When do you decide between a lumpectomy and a mastectomy? Isn't it always better to get rid of any chance of it coming back?
I love this question, so thank you, Becca, for asking, because that is the natural, when I first see patients, it's get it off so I never have this happen again. The reality, however, is after several decades of research, lumpectomy, when combined with radiation, is completely equal in survival, risk of recurrence to a mastectomy. So me taking off the breast, doing bigger surgery, doesn't make a better outcome for patients. The key is that we get around it with a clean rim of tissue, or what we call a negative margin. And sometimes we can't do that without doing the mastectomy. There's other nuances that we also have to think about, and that comes up in the consultation: genetic mutations, patient other comorbidities that might be taken into consideration on their ability to be able to get radiation or conversely undergo mastectomy. It's very personalized, but just remember, bigger surgeries, not better.
Good question. Okay, Linda has a question. Do people with depressive tendencies or those who are taking antidepressant medications have a higher risk of developing breast cancer?
Great question. To date, we do not have any solid evidence that shows that patients with a history of depression have statistically higher rates of breast cancer.
All right. Question is, how is immunotherapy different from chemotherapy?
Great questions this morning. And I'm sure my medical oncology colleagues are going to love me being a side medical oncologist this morning. No, but immunotherapy are going to be medications that actually elicit the immune system to be able to fight the cancer. We are fortunate that we have developed a couple of different, specifically for those tailored therapies. Currently within breast cancer treatment, it is coupled with a cytotoxic chemotherapy medication. Because original studies have just shown that when coupled, patients will have better outcomes. And in that specifically, what we have looked at historically is pathologic complete response, which means when they get chemotherapy before surgery, then I take them to surgery and cut that out. On the final pathology, the pathologist has been able to tell us what percentage of cells are still alive. Well, we want to see 0. And it's that coupling, and that's, again, how that tailored therapy all comes together so specifically for patients is important.
All right, there's no more questions from the community, but I have a question.
Yeah.
I'm so glad you're on this morning because I had an encounter last night that I need to get your advice on. I had dinner with a friend of mine. She's 53 years old, has never had a mammogram. And so I asked her, I said, well, when was your last mammogram? And she said, I've never had one. So I did kind of go into my what, kind of thing, and she said, I will have one when I want to have one. And I thought, kind of tick tock, when's that going to happen,
Yeah.
And so I was a little concerned, and she kind of got annoyed at me, I got a little defensive. She was a little defensive, and I said, I'm probably going to harp on you about this a little bit, and you'll probably be irritated with me, and I'm kind of okay with that. But how do you have conversations with people where you're not, they have their own reasons, and her reason was that she's afraid, she doesn't want to find out. Which then I went into my Jamie Wagner spiel of, well, it's better to find it early because there's lots of different options, and you can, there's, better outcomes when you catch it early, and so on and so forth. And so, yes, it was kind of an awkward conversation. And I was surprised because I really don't come in contact with a lot of women who haven't had their mammograms. And so, and now because I do the show, I think I'm somewhat of a, pseudo physician. So I didn't want to be judgy, but how do you have those conversations with women or friends that you come in contact with without shaming them, but really urging them? Because I was very concerned. I genuinely was concerned.
Yeah.
What is your advice?
Yeah, it's a hard position to be in, but if you really care about people, you'll have hard conversations with them, right? And do your very best to advocate for their health. And sometimes they don't understand, and I think have the privilege of having these kinds of conversations that we get to have. You explained it perfectly from the beginning. I was recently at a conference and I heard somebody make a statement that our advances in mammography and our advances with all the technology that are we're diagnosing more breast cancers. True statement, but it was followed on non-meaningful breast cancers that aren't going to threaten survival. So we are currently in an era that we are researching which cancers don't need to have treatment. Like maybe there is that subset, and it would not be an invasive cancer by any means. It's the in situ or the non-invasive cancers. But to date, we actually do not have the appropriate long-term data to even say that. The other aspect is we can't tell without doing a mammogram and diagnose the breast cancer if it's a meaningful breast cancer or not. I don't have the crystal ball to say that you are going to have a very aggressive triple negative or, like Ashley, HER2 positive breast cancer versus a patient who has a very almost dormant type of in situ disease. But the reality that we know is, why do mammograms improve survival? Because we diagnose them early. Very early stage 1, stage 2 breast cancers. The earlier that we find the breast cancer, the better the outcomes. Studies have just shown that time and time again. But in current era, the earlier that we do that, we have also been able to de-escalate a lot of our treatments in those much earlier stage breast cancers. So we don't have to give as much chemotherapy. Sometimes we don't even have to sample lymph nodes anymore for patients. But if we wait too long, then you're getting the kitchen sink.
All right. Well, I appreciate you having that conversation with me, because I was wondering what you would think about that.
Absolutely.
It was just, it made sense to have you here with me today. But yeah, it's just so important, and you never really know how to have those conversations.
Yeah, they're hard.
They are hard. Ashley, I bet you have more of these conversations now with your friends than ever.
I do. And honestly, I don't even have to have them. They watch my TikToks and have seen my story and just go and make their appointment all by themselves.
Perfect. I love that. I love that. You are doing your part, no doubt. What do you want the big takeaway to be, though, from your story for those watching and being inspired by you?
Well, as far as my care at KU, just because it's so far away doesn't mean it's not for you. The team is really willing to work with me and to give me the best outcomes too, even though I'm far away.
Well, thank you so much for sharing your story, and we're so glad you're doing well.
Thank you.
Dr. Lai, what's the big takeaway today?
I think the takeaway is that Ashley's story shows us that world-class care can reach every corner of Kansas. Distance shouldn't limit our outcomes. And when we're able to coordinate together oncology, breast surgery, plastic surgery, that patients thrive. Healing is about body, mind, and community, and we can provide comprehensive care no matter what the zip code is.
Absolutely. Dr. Wagner, what's the big takeaway from this story?
Well, it's always my takeaway, I think. And it couples Ashley's story with your last question, is be your own advocate. Second opinions can change lives. We've seen that. This is a perfect example of Ashley's story today, but advocate for one another as well. And if somebody says if your gut is telling you, get it. You're not harming anything by just a second conversation.